Hey everyone, welcome back to the channel. Today we're diving into a crucial topic that could save your life, recognizing the warning signs of heart disease. We often ignore subtle clues our body sends us, attributing them to stress or overexertion. But when it comes to your heart, every signal matters. In this video, we'll explore 5 signs in your body that indicate your heart might be in serious danger. Remember, knowledge is power, and understanding these signs could be the key to timely intervention and a healthier life. Let's talk about chest pain. It's a symptom that can be alarming and confusing, often leaving us wondering whether it's something minor or a sign of a serious condition. We've all felt it at some point, a tightness in the chest, a burning sensation that makes us pause and take notice, or even a sharp, stabbing pain that can take our breath away. While chest pain can be caused by various factors like indigestion, muscle strain, or even stress, it should never be taken lightly, especially when it comes to your heart. The heart is a vital organ, and any pain associated with it demands our full attention. When we talk about heart-related chest pain, we often refer to it as angina. Angina is not a disease itself, but a symptom of an underlying heart problem, usually coronary artery disease. Angina is a type of chest discomfort caused by reduced blood flow to the heart muscle. This reduction in blood flow means that the heart isn't getting enough oxygen, which can lead to pain and discomfort. It typically feels like a squeezing, pressure, or heaviness in the chest, almost as if someone is pressing down on your chest with great force. This pain might radiate to your arms, especially the left arm, which can be particularly concerning. It can also spread to other areas such as your jaw, neck, back, or even your stomach, making it difficult to pinpoint the exact source of the pain. Now, the intensity and duration of chest pain can vary greatly from person to person. Some might experience it as a fleeting discomfort, while others might endure it for longer periods. Some people experience mild discomfort that they might dismiss as nothing serious, while others describe it as an unbearable, crushing sensation that feels like an immense weight on their chest. Regardless of the intensity, any unexplained chest pain, especially if it's accompanied by other symptoms like shortness of breath, sweating, nausea, or dizziness, warrants immediate medical attention. These additional symptoms can be indicators of a more serious condition, such as a heart attack. In such cases, it's crucial to act quickly. Don't hesitate to seek emergency medical attention. Don't hesitate to call 911 or your local emergency number. It's always better to be safe and get checked out by a professional. Remember, time is muscle when it comes to heart attacks. The sooner you get help, the better your chances of minimizing damage to your heart muscle. Early intervention can be life-saving, so never ignore chest pain or delay seeking help. Breathing is something we often take for granted, but when you find yourself gasping for air, it's a clear sign that something's not right. Shortness of breath, also known as dyspnea, can be a frightening experience, especially when it comes on suddenly or is severe. While it can be triggered by various factors like allergies, asthma, or even anxiety, shortness of breath can also be a red flag for heart problems. When your heart isn't pumping efficiently, it can lead to fluid buildup in the lungs, making it difficult to breathe. This is particularly common in heart failure, where the heart muscle weakens and struggles to pump blood effectively. If you experience shortness of breath, especially when lying down, or if it's accompanied by chest pain, wheezing, or a rapid heartbeat, it's crucial to seek medical attention promptly. Your doctor can determine the underlying cause of your shortness of breath and recommend the appropriate treatment. Remember, ignoring this warning sign could have serious consequences for your health. Chapter 3. Swelling. When your body retains too much fluid. Swelling, also known as edema, might seem like a minor inconvenience, but it can sometimes be a sign of a more serious underlying condition, especially when it comes to your heart. Edema occurs when your body retains excess fluid, causing tissues to swell. While it can affect any part of the body, it's commonly observed in the legs, ankles, and feet. When the heart isn't pumping efficiently, it can lead to fluid buildup in the extremities, resulting in swelling. This is because the heart's pumping action helps to circulate blood and fluids throughout the body, and when this process is compromised, fluid can accumulate in the tissues. If you notice persistent swelling in your legs, ankles, or feet, especially if it's accompanied by other symptoms like shortness of breath, fatigue, or unexplained weight gain, it's essential to consult with your doctor. They can assess your symptoms, determine the underlying cause of the swelling, and recommend the appropriate treatment plan. Remember, Addressing edema promptly is crucial, as it can sometimes be a sign of a more serious heart condition. Edema can also manifest in other parts of the body, such as the hands and arms. In some cases, it can even affect the abdomen, leading to discomfort and bloating. There are various causes of edema, ranging from high salt intake to certain medications. It can also be linked to kidney or liver disease, which require medical attention. Making lifestyle changes, such as reducing salt intake and elevating the affected limbs, can help manage mild cases of edema. Wearing compression stockings can also aid in reducing swelling by improving blood flow. Regular exercise is another effective way to prevent fluid retention, as it promotes healthy circulation. However, if the swelling is severe or persistent, it's important to seek medical advice. Your doctor may recommend tests to determine the underlying cause and the best course of treatment. In some cases, diuretics may be prescribed to help your body expel excess fluid. Monitoring your symptoms and keeping track of any changes can be helpful in managing edema. Maintaining a healthy diet and staying hydrated are also key factors in preventing fluid retention. Being aware of the signs and symptoms of edema can help you take action early and prevent complications. Always consult with a healthcare professional if you have concerns about swelling or fluid retention. By understanding and managing edema effectively, you can improve your overall health and well-being. Chapter 4. Irregular heartbeat. When your heart skips a beat. Our heartbeats are usually so steady and rhythmic that we hardly notice them. The heart, a powerful muscle, works tirelessly to pump blood throughout our bodies, maintaining a rhythm that keeps us alive and well. But when your heart starts racing, fluttering, or skipping beats, it can be a disconcerting experience. These sensations can catch you off guard, making you feel anxious and concerned about your health. An irregular heartbeat, also known as arrhythmia, occurs when the electrical signals that coordinate your heartbeats don't function properly. These signals are crucial for maintaining a consistent heart rhythm, and any disruption can lead to irregularities. While occasional irregular heartbeats can be harmless, especially if you've had too much caffeine or are feeling stressed, it's important to pay attention to the frequency and severity of these episodes. Stress and stimulants can temporarily affect your heart's rhythm, but they usually don't cause long-term issues. Persistent or bothersome arrhythmias can be a sign of an underlying heart condition. It's essential to monitor your symptoms and seek medical advice if you notice any changes in your heart's behavior. One common type of arrhythmia is atrial fibrillation, or AFib, where the heart's upper chambers beat chaotically and irregularly. This condition can cause a variety of symptoms, including palpitations, fatigue, and shortness of breath. AFib can increase the risk of stroke and heart failure if left untreated. The irregular beating of the heart can lead to blood clots, which can travel to the brain and cause a stroke. Additionally, the heart's inefficiency in pumping blood can lead to heart failure over time. If you experience frequent or prolonged episodes of irregular heartbeats, especially if they're accompanied by chest pain, dizziness, fainting, or shortness of breath, it's crucial to seek medical attention immediately. These symptoms can indicate a more serious condition that requires prompt treatment. Seeking medical attention is vital to determine the cause of your symptoms and to receive appropriate care. Early diagnosis and treatment can help manage the condition and prevent complications. Your doctor can perform tests to diagnose the type of arrhythmia and recommend the appropriate treatment to regulate your heartbeat and reduce the risk of complications. Treatments may include medications, lifestyle changes, or procedures to correct the heart's rhythm. By working closely with your healthcare provider, you can take steps to protect your heart and maintain your overall health. Chapter 5. Extreme fatigue. When your body is constantly exhausted. We all experience fatigue from time to time, especially after a long day or a poor night's sleep. But when fatigue becomes persistent and overwhelming, interfering with your daily activities, it's essential to pay attention. While fatigue can be a symptom of various conditions, it can also be a red flag for heart disease. When your heart isn't pumping efficiently, your body has to work harder to circulate blood and oxygen, leading to feelings of exhaustion. If you experience extreme fatigue that's out of proportion to your activity level, especially if it's accompanied by other symptoms like shortness of breath, chest pain, or swelling in the legs and ankles, it's crucial to consult with your doctor. They can perform tests to evaluate your heart health and determine the underlying cause of your fatigue. Remember, ignoring persistent fatigue could delay diagnosis and treatment of a potentially serious heart condition. Your heart works tirelessly to keep you going, so it's crucial to pay attention to the signals it sends. If you notice any of these signs, please consult with a healthcare professional immediately. Early detection and treatment can make a world of difference in preventing serious heart problems. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy and take care of your heart.